Hi team, my name is Christina Creer and this is my presentation for Caritas process number 3 for our class Foundations of a Caring Science. Today is April 19th, 2021. My objectives for today are to discuss Jean Watson's nursing theory. Number 2, Caritas meaning. 3, we'll go over the 10 Caritas. 4, Caritas in the Caring Science. 5 is the Caritas that I chose, number 3. And 6 will be the Caritas and how it applies to our nursing practice. So a little bit of the Caritas background is Jean Watson, a nursing theorist, who believed that maybe this one moment with this one person is the very reason we're here on earth at this time. In my research, I saw that Jean Watson basically during the years of 1975 to 1979, she did her studies and developed the Watson's nursing theory of human caring. Closer to 1979 is when it was developed and noted to be a grand theory. Grand theories are said to be more abstract and difficult for people to actually grasp the concept of it because it's not tangible. They're not concrete. This nursing theory focuses on promoting health and as well as the treatment of disease, and also just human beings caring for one another. So this slide, it's a little wordy, but it shows you all 10 Caritas. Again, I chose number 3, cultivating one's own spiritual practices and transpersonal self, going beyond ego. I think it's important for us to be able to go beyond ourselves as healthcare providers so that we can acknowledge and accept the differences that exist between us and our patient population. So after seeing the wordy slide, this is a more simple definition of Caritas. It talks about the love of humankind and charity and virtue. And so through those things, if we're able to possess them, we can then have a practice that will flourish. This should actually be peace. Sorry about that. One that has dignity that we are able to extend to our patients, and they can feel that they're receiving care that is of a dignified nature. Through these practices of flourishing and having peace and dignity, we then promote the well-being and the health and justice that is needed for us to have in our practice and for our patients to understand that we actually care about them. So again, Caritas number 3 that I chose, this one is paraphrased. Trust self and others by nurturing individual beliefs, personal growth, and practices. And so one of the quotes that I found online that I thought was interesting says, if you want to trust other people, you must first learn how to trust yourself with other people. And I think that this is really important in order for us to establish mutual trust with our patients and with their families, that we are able to extend reciprocity as far as trusting and respect goes, from individual beliefs, whether they're our own, whether they're something that we learned in the home that we grew up in, and also acknowledging those individual beliefs that exist for the people that we take care of. Through Jean Watson's Caritas of trust self and others, and through the whole brand theory, again, it's an abstract theory, something that you really can't put your finger on, but it does exist. The beliefs of others, the cultures of others, as well as those of our own. So the trust and respect and caring begins from the very first time we do our assessment, right? Nursing 101, we do our head to toe. We're creating our plan for this patient. We're talking about their diagnosis and what plan we have for them, what type of interventions will be effective for them. And we do these things by evaluating what we assess, We actively listen to the patient and their history or medical history and what they're able to share as a historian for self. And then we're being present there, right there with the patient, with the active listening, the nodding of the head. We're acknowledging that we are hearing what they're saying. So this is a way that we begin to build our trust and to show that we care through our nursing practice, right? So the nursing practice, it consists of, objective and subjective data. There's some things that we see for ourselves. There's some things that we have to believe that the patient tells us, because whatever they tell us is real for them. When they say that my pain is a 10 out of a 10, even though they're smiling, we may have to say, well, why are you smiling? But we have to figure out, where are they getting this 10 out of a 10 pain from? But we have to care enough to try and understand that maybe their coping mechanism is one of smiling. Maybe theirs differs from ours. So we have to care enough to make sure that we're understanding them and care enough to make sure that they understand us. We want to ask for the patient's input, because remember, we're building trust and we want them to know that we care. So we have to communicate in such a way that patients understand that we do care what they're saying, we do care about their input, and that they are actively involved in their plan of care. So as we break that down, we talk about revealing and listening, which will lead us to understanding right there in the middle. So we reveal things that we're going to practice. We're going to reveal things that are our interventions and what our goals are and how long we think those goals are going to take. We want to make sure that our patients are listening and understanding what we're saying. We may ask them to do a teach back. We may ask them to repeat back what we said. But if we go in just constantly questioning and questioning and questioning, it may begin to feel like an interrogation as opposed to us trying to get enough information to treat them appropriately. So we want to explain to them, I need to ask a series of questions and why I have to ask those questions, and then let them know, because of the answers that you gave me, this is what I've established will be beneficial for you. And hopefully we can get to a level of understanding where we understand what's important to them and they understand what's important for their treatment and the things that we're going to do. So another continued benefit of a caring science from Jean Watson is that we talk about core values, things that are important to us and that are important to the families and the patients. And again, establishing this mutual respect may be difficult because we all may have different beliefs. So you have some families who believe in a miracle. And even though you've seen the clinical data and you don't think that what they want is possible, we still have to acknowledge that their feelings are real. We have to care enough to say, this person feels this way and I need to acknowledge it and accept it, even though I don't agree with it. We're not asking, or Jean Watson's theory is not asking that you change what you believe, but it is asking you to acknowledge and be respectful of other people's core values and their beliefs, which would then lead to a mutual respect. Another part of Jean Watson's nursing theory of acceptance of similarities and differences, and I think that sometimes it's really easy for us to acknowledge the similarities between us and other people, our communication styles, the choices of words, and some of those things can also be our differences, the way that we communicate, the words that we choose to form a sentence. We all, at all times, have to be non-judgmental and be respectful. When we acknowledge that there may be different communication styles and differences in our word choices, we then begin to realize that some of the things that we have in common, most importantly our families, is that even though we may pray differently, even though we may form sentences differently, for the most part, all of us want what's best for our family, for our loved ones. And when we're in those hospital settings, it's not always easy for us to find a comfort zone. And that is what us producing a caring environment can help. It can help people get to a level of comfort where everybody is feeling respected, feeling heard, and they're not feeling judged. So along with the Caritas Number three, we talk about the personal growth that stems from different perspectives. And are you able to get beyond your fixed mindset or things that you have always thought to be true, or thought it should be done a certain way? Can we get past those things so that we can be accepting and acknowledge other people's perspectives and what's important to them, and that their priorities may differ from ours in order to give them the best health care possible? I think that when we talk about acknowledging people and meeting them where they are, in their acceptance of the disease process, of their acceptance of a change in their health care, we will then be able to treat them or assist them to their optimal level of health, which is ultimately what we want to do as a healthcare provider. No matter what that level is, it could be someone transitioning from life to death, and death may be their optimal level of health. There's nothing left clinically that the body can do, but again, we will assist that person die with dignity. That's part of caring, is acknowledging what is best for the patient and what their personal goals are, and we assist them there. I think that when we maintain our professionalism over personality and recognize the job that we have to do, we will be able to better care for the populations that we are serving. I really appreciate you guys for watching. Thank you for your time. I do have some references here of some websites that I used, and I hope you all have a good evening.